Hello. What's psychosis? The way I think of it is somebody's not in touch with reality. They may experience delusions or hallucinations. So a delusion is a fixed false belief that's held even with evidence to the contrary, and it's often bizarre and out of keeping with a person's cultural, religious or social background. A hallucination is a false perception, so in any of the sensory modalities, which are vision, hearing, taste, smell and touch. The commonest one is auditory, hearing hallucinations, hearing voices, 1, 2, arguing or talking about somebody talking to somebody. And these are heard with people's ears, appear to be outside their mind in external space, and are very real to them and appear the same as if somebody was there talking to them. But it actually comes from the mind due to an illness. So schizophrenia is a psychotic disorder, and that has hallucinations and delusions. It also has symptoms of thought disorder and negative symptoms. So thought disorder is where people's words get jumbled up, so it's difficult to make sense. They may move from one subject to another with no obvious thread in between them, and they may have new words that they use called neologisms. And positive symptoms mean a presence of symptoms like hallucinations or delusions. Negative symptoms are where people's lives are affected negatively. So people may self-neglect, so they're not washing, they're not looking after their surroundings, tidying up their flat. They may not be cooking for themselves, looking after their diet. They may talk less, avoid, become increasingly isolated and away from social situations. There's a whole heap of negative symptoms which are in one of my talks on positive and negative symptoms of schizophrenia. So that's schizophrenia, which is a psychotic disorder, has hallucinations, delusions, positive, negative symptoms. Going on to another psychotic disorder called persistent delusional disorder. So it's persistent, so all the time. It is delusional because people have delusions, which I've talked about, false beliefs out of keeping with their normal background. And it's a disorder. People who have that don't have hallucinations, and generally they can go to work and go through their normal activities and routine. Another disorder that comes under this category is schizoaffective disorder. Now, the schizo part means schizophrenic symptoms. The affective part means mood symptoms. So, for instance, people may have symptoms of schizophrenia at the same time or a few days between them as mood symptoms. And these mood symptoms may be manic, depressed or mixed. So people may have schizophrenic and be high in mood, schizophrenic, be low in mood, or schizophrenic and have high and low mood together. Right, so we talked about psychotic disorders. Remember to like, subscribe, and make a comment or suggestion. Thank you very much. It's Dr Beth Colby from Talk Mental Health. Bye-bye.